So they're the different forms of the pill. If that doesn't work, then what do we look at?
So we move on to the next group, the second and third group, which are a different class of medication. These are mixtures of medications that are vasoactive, okay? Usually it's a combination of three: prostaglandin, papaverin, and phentolamine. They'll come in two different forms. One is a gel form and the other one is a liquid form. These are local therapies, and so you're not going to have the side effect that you typically would see with some of the pills.
Okay.
These are local therapies you inject right into the actual phallus. So this is a cross-section of what the inside of a penis looks like. It's a little lopsided, but if I move it this way, you have right up here the two corpora cavernosum.
Oh, you can put it up. There you go.
This right here is where the actual blood flows in, and here's your urethra. And so for the gel form, you put it into the actual urethra. So a few minutes before you have sexual intercourse, you'll have, let's say, a syringe that has no needle, and you'll put it right at the tip of the penis and push it in, hold it in a few minutes.
You do it yourself?
Gel. The patient does it themselves a few minutes before they have intercourse.
Okay.
That's the gel form. Then you have the probably one of the oldest forms of therapy that we have, which are the injection forms. Typically, you get a needle like this, which is an insulin, your standard insulin needle, holds about 1 milliliter worth of fluid, and then you'll get a medication that comes in a little vial like this.
And you do that yourself as well?
The patient does it themselves. It's again a mixture of papaverin, phentolamine, and prostaglandin, 3 vasoactive medications. You can have a combination of 2, 3. You would take some fluid out, and then you would take this needle, and you would take the actual phallus right here, and you literally just inject it right into the side of the penis at the base right before you have intercourse. Everybody, when they see the needle, they sort of they cringe. Yeah.
Well, nobody likes needles.
Nobody likes needles, period, let alone needles in that area.
But does it hurt?
Most guys get used to it. Most guys will come in worried about it, and by the time that we're done trying it out, because I always do one test injection in the office, they say that's not that bad. This has been around since the 1980s. You can imagine there's a lot of men who still use this. One of the most popular forms of therapy. Now, this therapy, though, you have to realize that this is a vasoactive substance, and so with the medications, the pills, you need stimulation. With this, it purely is related to the concentration and the amount of the volume that you're injecting.
And it works instantaneously.
And within a few minutes, it should work, and you want the erection to last less than an hour. That's the importance of starting with a low concentration and working your way up.